I think a lot of what I seem to sort of be beating the drum about on this subject is the need for more nuance in how we think about what people are dealing with about vaccines and vaccine access, vaccine misinformation. And one of the things I kind of want to talk about today, since we are talking about misinformation, is getting into some of that nuance that gets sort of erased when we just say, oh, we need to address vaccine misinformation. It's sort of an oversimplification of the process. This is a complex issue. We need to understand it. We need to understand what that complexity is, and then we can better understand how to approach it. One of the things that we're seeing with anti-vaxxers, with vaccine misinformation, with so much of this, is that a very small but very vocal contingent gets all the attention when the people that we actually need to worry about are the people who surround that small, loud group. This is a persistent, pervasive cultural crisis of misinformation. Tim touched on that, and I'm sure he'll speak to it again later. None of us are going to solve this overnight. We're not going to solve it on our own. What I want to talk about today is how we have those one-on-one conversations with the people who are not the extremists, but that are the ones that are extremist adjacent or just surrounded by this extremism that hasn't allowed them to understand any of the nuance in this conversation. I do want to say, I don't think anyone should be out there trying to persuade the people who are like screaming at healthcare workers or issuing death threats. Like, there are people in this conversation who are actively dangerous. Don't try to engage with them. The people we want to identify and try to talk to are those ones that are one step removed. They're surrounded by it, but they just don't know who to trust. They aren't impossible to reach, but they're harder to find. So once you've figured out who some of those people are, often your trick is to find the family members of the most vocal, extreme people and reach out to them. And what you want to do is identify the source or the type of misinformation that they are falling prey to. Because there's so many different types and categories of misinformation, we can't take the same approach to all of those types to combat it. There's not a one-size-fits-all solution to this. Maybe you can't trust the government, they're withholding the real cures, so big pharma can make the money, whatever, the ivermectin crowd are on about this week. There's the COVID is a big hoax. You can't trust the doctors, the hospitals are empty. I've seen the pictures. There's my church says the vaccine is a sin crowd. There's the I don't want to get vaccinated because I hear it's going to make me infertile, which one of our other panelists is going to speak more to later. But the sort of easiest one to tackle is the one where it's just truly misinformation that is a misunderstanding. And some of that is often easier to address if you aren't coming at it with people in a more sort of combative approach. It's so hard to do this sometimes when we're all just absolutely out of capacity for like empathy and thoughtfulness in our conversations with people who are not contributing to the efforts to end the pandemic, but there are still people out there who can be reached. One of the big ones is people who think that the vaccines were too rushed, for example. If you tell them, don't worry, they didn't rush anything, they're not going to believe you because that's just not, they don't have the baseline level of trust to believe you. But if you say something along the lines of, government red tape is just slowing everything down all the time, we know what a problem, this bureaucratic nonsense is. The only reason this could happen so quickly is because this was such an emergency that they could get rid of all those hoops they had to jump through. And so it's the same thing you're telling them. They didn't cut any corners. The corners they cut were the bureaucratic corners. But because you're framing it in such a way that is reaching them where they are, you're more likely to get that opening to talk to them further about it. And so I'm not suggesting that anybody should be validating false information or even encouraging the spread of false information, but it's all about how you frame it with them, because there is sometimes, in some cases, like some understandable fear that's underlying these beliefs. Again, not with the extremists who are beyond reason, but with the people around them who are they're afraid and they're uncertain and they don't know who to talk to. And another thing I want to mention about that is that the language that we often hear and just heard just now from the new Minister of Health is, if you have been unsure about this vaccine, talk to your healthcare provider or a trusted healthcare provider of some kind. First of all, not everybody has a trusted healthcare provider. Second of all, that's not the right advice when it's someone who doesn't trust the healthcare system, and that is their issue with the vaccines. If they're the ones who are like, well, this is all a hoax, they're lying about the hospitals being full, this is all just false information, telling them to talk to a trusted healthcare provider is not actually going to solve the problem. So what you need to do in those kinds of cases is sort of try to pick away in these conversations, like where are they getting their information and what are the underlying beliefs that they've bought into? And then picking out someone in their lives who is going to be able to be a trusted ear. You've got to have maybe it's someone, we're seeing this in Edson now, where there's a sudden significant uptake in vaccination rates because they know so many people there who are sick. Often, if they can have a one-on-one conversation with someone in their lives who's been in the ICU or has a family member who's been in the ICU or a friend in the ICU and hear about what's actually happening, that's going to be a much more effective person for them to speak to about addressing that misinformation than a healthcare worker if that's someone that they don't trust. If it's just the personal connections are what you need. And so for every scenario that underlies someone's vaccine misinformation, you need to make sure you've got the right person who can address those baseline starting assumptions that someone's working with. It's totally understandable to be just out of patience for anyone who's not vaccinated at this point, but it's hard to picture for those of us who are not in this situation what it must be like to be a person who's unsure about the vaccine in an area where there's like a 35 to 40% vaccination rate and you are swimming in this toxic pool of misinformation all the time. And this is not, and I said this last time I was on, this is sort of my one trick pony of it's so complicated, is that this is a systemic failure. This is not an individual failure. In some cases, it's an individual failure, but it is an underlying systemic failure that this misinformation is so pervasive that they've never had the opportunity to hear those different perspectives. We owe it to them to try to reach them, but we also owe it to the rest of us. Like, this is a selfish desire on my part. I would like more people to get vaccinated, and I am more sick than the average person of talking to people about vaccination, but it's the only way out of this. And so we've just got to keep trying, even though it is endlessly frustrating and exhausting and infuriating. There's just no alternative at this point.
Before I bring on our next panelist, from your perspective, because I'm an action-oriented human, what is your current or first of mind open-ended question to start a conversation with someone who hasn't been vaccinated?
So my fellow Vax Hunter Janaea found a TikTok. We can discuss later whether TikTok is a valuable source of information, but it is a good way for getting ideas for starting these conversations. And she found and shared a TikTok a while ago that talked about the way to open a conversation with someone who isn't vaccinated is ask them on a scale of 0 to 10, with 0 being, I will never get the vaccine because I believe that it is evil incarnate and poison, that will track us through the government, whatever. That's your 0. 10 is like, I was lining up at the door the day that they let me in. On a scale of 0 to 10, where do you land on the getting vaccinated front? And if they say anything but 0, then you say, why aren't you a 0? What's the difference between you and a 0? What's the thing that makes you say, well, maybe one day I'll get it? And that it puts them not on the defensive. You're not accusing them of anything. You're merely trying to understand where they're falling on that spectrum. Part of that is a time-saving method. If they're a 0, like, move on with your life and find your next person. But even a 2, if they're like, I don't know, like a 2. Oh, okay. Like, what makes you not a 0? What is the thing that makes you think, well, maybe one day I'll get around to it?